I'm Dr. Christine Horton, and I'm hoping I can take a few minutes of your time to update you on some of our more recent and exciting advances in the G.E.M.M protocol. If you're not sure, G.E.M.M is the acronym for gut ecology and metabolic modulation. And since we've been teaching other practitioners how to use the G.E.M.M protocol in their clinics through our half-day seminars, I've been quite overwhelmed by some of the early responses. It seems that not only did the seminars really strike a chord with many, but just weeks later we have practitioners reporting successes with some of their more difficult patients. You know, the ones who've seemingly been everywhere and have done everything. One case is of a patient who can now eat virtually everything after years of multiple food intolerances following antibiotic treatment of a protozoal infection. Another of our very enthusiastic practitioners is reporting very good early responses with 3 of her SIBO patients. We also have 2 clinicians who've diagnosed their own pre-diabetes and are now monitoring it and on the way to correcting it through the principles on which G.E.M.M is based. So you might ask, what is it about G.E.M.M that's different from what we already know? In a single sentence, it's this. G.E.M.M is scientifically anchored in the principles of natural medicine, but is implemented within the context of a 21st century lifestyle. Or put another way, G.E.M.M aims to mimic nature and all the benefits that modern science can offer. Now, I know that doesn't really tell you how it works, but with my 30 years clinical practice experience and an academic background in nutritional biochemistry, nutrigenomics and phytochemistry, I realised a while ago that there was some vital information missing from the way in which we've been addressing gut health. And that led me on a mission to identify the missing pieces of the gut health puzzle. Luckily, when you ask the right questions, the answers start to emerge. And so the first question I asked myself was this: if nature has sustained human life on the planet for millennia, what are the processes embedded in human cells to explain this? And so then I reasoned that if I can work out how best to mimic the exact processes used by Mother Nature herself, we might have the strategy we need. And so G.E.M.M was born. In the 2 years that I've dedicated to developing this approach, I have culled through literally thousands of peer-reviewed journal articles across many scientific disciplines to gain a better understanding of how human cells maintain their homeostasis, especially within the gut. One of the things that makes G.E.M.M different is that it directly targets the intestinal epithelial cells. These remarkable multitaskers essentially head up mission control within the gut ecosystem. And when they get back to their multitasking duties, lots of things start moving in the right direction. The science also taught me how to influence the intricate signalling mechanisms that start in the gut and link to every other organ and system of the body. It's by harnessing these processes that G.E.M.M addresses the whole gamut of other chronic diseases such as obesity, type 2 diabetes, fatigue, liver dysfunction, endocrine disorders, and so on. And all by mimicking Mother Nature. Complex as these mechanisms are, part of my 2-year mission was to extract the essence from the relevant branches of science and piece it all together in a way that was easy to implement in the clinic. In fact, the 48-page G.E.M.M implementation guide that you will receive amongst your training materials reinforces the notion that the science is complex, but the implementation is simple.